Because there are like multi-causal factors in my illness, there's going to be different multi-causal treatments. Hi there, my name is Samantha, and I'd like to share my chronic UTI story with you. And so the reason I would like to share my story is because chronic UTIs, chronic embedded UTIs, are an uncommon condition, and I want people to know that they're not alone and that there's hope for healing in their future. I have always suffered with feelings of UTI post-intimacy ever since I was a teenager. This was usually remedied with a single dose antibiotic that was prescribed to me by my OBGYN, and I would take that antibiotic one dose after intimacy or before, and this seemed to remedy my UTI symptoms for many, many years. My chronic UTI started at this time during the COVID pandemic. During this time, I contracted COVID-19, and I also received the vaccines for COVID. During this time, I think the year 2021, I started developing pelvic floor discomfort, weakening urine stream, and this escalated over the course of a year to where post-intimacy at one point, then I started having very severe similar symptoms of burning frequency and urgency. I also had an odor to my urine. And so I went to the emergency room and saw a doctor, and they prescribed antibiotics for me. Those antibiotics would work for a period of time, and then gradually, they worked for several days, and then nearing the time of when I was almost out of the antibiotics, the symptoms would come back. And then I'd go back to the emergency room or back to an urgent care. And it was a similar cycle of being prescribed antibiotics, then providing some relief, but not fully curing the bacteria. At that time, during the cycle, I had some doctors tell me they thought maybe I had a condition called IC, or interstitial cystitis. And so that was a possible diagnosis. However, after doing some research and doing deep dives into everything, I come to believe I had a chronic embedded UTI. My personal professional background is in critical care medicine, and so for me, based off my symptoms, I believe that I had a chronic embedded UTI, that it just wasn't showing up on some tests. I did have providers tell me that sometimes the bacteria hide in the tissues and then, the urinary tract. And that's why some providers continue to prescribe antibiotics, because they said the bacteria were likely hiding, and, to just continue to push forward if I was getting relief from the antibiotics. So in terms of the chronic embedded UTI diagnosis, I did kind of a deep dive into research. I found the website Live UTI Free, and the things that were described on the website seemed to match kind of all my experiences. So I sought out a functional medicine doctor who confirmed that I had chronic embedded UTI. I had DNA and PCR testing done. And I also consulted with a chronic UTI specialist that's a urologist. And that person said that I likely had an embedded UTI for as long as I had been experiencing these symptoms, so likely over 20 years. In terms of the treatments that I pursued, in the treatment of UTI, I pretty much tried everything possible. Treatments for embedded UTI, treatments for IC. I did pelvic floor therapy. I did mindfulness and therapy, mindfulness techniques. I utilized supplements like D-mannose, cranberry, PAX, herbs, everything that you can think of, including antibiotics. Physically, the treatments that I tried were kind of minimum, considering everything that I had been through. As far as a negative impact, positively, my UTI symptoms were improving with treatment. Negatively, minor stomach discomfort with some antibiotics or herbs, but I also increased the intake of probiotics, and that seemed to help with my kind of gut discomfort at times. The psychological impact was the most significant impact that I found, these various treatments to have, was on my mental well-being, and just kind of the very act of being previously healthy and then all of a sudden being debilitated by pain and suffering. And some people telling you, oh, this is kind of in your head. This is your new norm now. You kind of have to live with it, versus other people saying, oh, this is an embedded UTI. You have to try these different treatments, and you should be better by now. Those are kind of all things that affected me psychologically. I would stay up, all hours in the night researching, trying different things. I joined different Facebook groups and online groups, and people would say, try this, try this. If you take this, you could go into liver kidney failure. So just kind of like scare tactics and techniques. So all of this was all very overwhelming for me, trying to navigate the research, the anecdotal things people would say, and then trying to figure out, am I doing the right thing for myself? It definitely felt like a very lonesome experience, because it has been very much me navigating this, the symptoms, experiences, the medical care kind of alone. And then, as a lot of people have said, it seems like the patient seems to be more knowledgeable than providers in some situations. And so that's kind of having that feeling like you don't question what providers are telling you, but your personal experiences kind of tell you something different. So all of that kind of plays into your stress levels and in your mental health. In terms of what has made a difference the most for me, number one, hands down, is having found validating and knowledgeable providers who understand the pathology, the science behind chronic embedded UTI. You don't have to fight to be heard. You don't have to fight to be believed. And then they, tell you, this is what this is. We know how to help you. We know how to help you get better. That's validation has been the number one thing for me during this journey. The second most helpful thing I would say is the DNA and PCR testing. And while it's said that you don't need DNA PCR testing to start treatment, which I tend to agree with, that's kind of seconds that validation component, because once you see, and for me, I had 5 different bacteria show on my DNA PCR testing, all with different, some gram positive, some gram negative, and they all have different needs in terms of medications and treatments. And so for me, seeing that on paper was a validation that I needed, like, no, I'm not crazy. And then I could show that to my doctors who didn't believe me and say, no, look, this is what I have going on here. And so that was definitely transformative as well. Suddenly I had people people weren't telling me, oh, you have interstitial cystitis. They're saying, oh, I see there's bacteria there. We can treat bacteria. The next things that have been very helpful for me are medications called Hiprex, or methenamine hippurate, and methylene blue. Both of those were very helpful when I didn't have bacteria showing on my tests and I was in a lot of pain. And those are kind of broad spectrum antibiotics, but anti-pathogens. And both of those helped when I couldn't identify my bacteria and start on an pharmaceutical antibiotic to treat the condition that I had. The next thing that's been super helpful for me are biofilm busters. Some people with our condition tend to form fibrin clots and biofilm more easily, and some bacteria themselves form biofilm more easily, and keeping those busted out have definitely helped with my symptoms, and I believe they're like chipping away at these communities that I have. In terms of treatments, very helpful. I wouldn't be caught without Demanos. I love Demanos. It's been very helpful for me, not just for E. coli, but for Klebsiella, and it's been shown for other bacteria as well, gram-negative. Packs, cranberry packs with the 36 milligram have been very helpful. Vitamin C to acidify the urine, uva ursi, absolutely antibiotics. I don't think I'd be here being able to talk to you without the antibiotics that I've been given. I also regularly drink bladder soothing teas to help with the inflammation and the burning. Those would include corn silk tea, hibiscus, ginger, calendula tea. The added benefit is you don't want to take anything that's going to coat your bladder and block the antibiotics and antimicrobials from working. But these teas are soothing, but they also some of them kind of work as antibacterial and antibiofilm teas as well. So I keep that to keep my urinary tract system flushed as well. The other thing that I tried that I feel like has been very helpful, I kind of hit a new level in my healing, is I was fortunate enough to be able to be offered the Euroimmune vaccine. And I took that vaccine. I was able to get that. And I took the sublingual spray for 3 months. And I did, like I said, reach a new level of healing in that. I feel in that vaccine, it had 3 of my most prevalent bacteria in that vaccine. So again, I thought that was very helpful. How do I feel that my UTI story is unique? During the course of my treatment and seeing functional medicine providers and seeing my chronic UTI specialist, I had a multitude of tests done and discovered that I had not only, immune system dysregulation, but I had other viruses and pathogens come out. And come to the surface and be positive in my testing, and other bacteria, including Lyme disease. And it is thought that Lyme disease can weaken your immune system and kind of contribute to these UTIs as well. So I have had a myriad of different viruses and bacteria come out during my treatment of chronic UTI. So we mentioned COVID, chronic UTI, Lyme disease. I've had, fever blisters on my lip, Epstein-Barr virus. There's just kind of a multitude. And I think also as you're breaking down biofilms, these things that kind of congregate together come out. And then you have to kind of treat those as they pop up. Because there are like multi-causal factors in my illness, there's going to be different multi-causal treatments in my treatment as well. And so that kind of made me learn that this treatment is not going to be a 3 to 5 to 7 day course of antibiotics. This is going to be some time to treat all these different things that are affecting me. And so I think that makes my story unique. And also the fact that I've, kind of sought out different experts to help me with those different things I'm dealing with as well. So while not everyone who experiences chronic UTI might have the same underlying factors that I do, what I want everyone to know is that chronic UTI might be not very common, but UTIs themselves are a very common disease. Millions of men, women, and children suffer with UTIs every single day across the world. It's a very serious illness, but it's not a death sentence. It's not a cause to dismiss either, because we know that, sepsis and urosepsis is a leading cause of, morbidity and mortality in the world as well. So I think this speaks to the fact that we need better identification and better treatment, because lots of people are dealing with this. And it's just, I feel like it's kind of this insidious thing that, everybody knows that UTIs are common, and they're kind of, like, oh, I have a UTI again, especially for females, that it's kind of very like, you suffer in silence. This is like the norm kind of thing. But I think we deserve treatment. We deserve to not have to live with this, this very common pain and suffering. This UTI has affected my life in all the ways possible. In the beginning, I cried all day, every day. I was fortunate enough to be able to work. I have a very understanding job, and so I would go to work. Sometimes I would cry at work. I would come home. I'd cry and crawl in the bed and sit on a heating pad, and that would be, every day. I couldn't clean my house. I had a hard time, playing with my children, cooking, all of that for probably 6 months. I was essentially bedbound. So as I started treatment, I started, feeling better. I started getting providers who believed me and could help me. I also started seeing a trauma-based therapist and kind of developed, relationship with myself to understand the mind-body connection. This by all means doesn't mean that you start seeing a therapist and your bladder pain is going to go away, but it kind of helps you cope with everything that you're dealing with as a result of this debilitating condition. So now I see this trauma-based therapist. During the time, I would listen to a lot of podcasts. I would walking for me in the evening with my partner was kind of like I needed to do that every night. If I skipped a night, I could definitely feel myself kind of spiraling in this, anxiety state again. So walking, podcast, reality, TV shows, things like that to keep my mind off of like the doom scrolling on my phone and continual research. I kind of had to learn to trust my providers once I found good ones and trust the process. In terms of lessons learned, for me, all the credit goes to my partner, who is very supportive in everything I wanted to try. At that time, he was supportive of traveling to see these specialists and the funds that were needed and the time that was needed and a shoulder to cry on when I didn't know, what I was going to do, if this was ever going to get better. And so for definitely having that support system was everything to me. And so, and the same kind of goes to the providers that I had as well. They were also not just, helping me with my treatment, but the fact that they believed me and let me cry in their office, cry on our video calls, and say, it's okay, it's okay to cry. This is hard. You're doing something hard, but it's, you're going to get better. My advice for someone else would be to surround yourself with people who care about you, and someone who can be that rock for you. And, sadly, not everyone has supports in their life. And I firmly believe that if you don't have someone, you can be that someone for someone else. And that also helps your healing as well, is to find that community. I want to thank you guys so much for listening to my story. I hope it was helpful for someone. And, I wish you love and comfort and healing along your journey. Thank you so much.
Hi, I'm Bianca from Love. I hope you found this video helpful. There's no single approach that will work for everyone when it comes to health, so I invite you to watch more patient videos here or read more stories over on our website, liveUTIfree.com, and take what resonates with your journey. Remember, it's always best to consult with a clinician before trying something new. If you'd like to share your own story, please get in touch. Our info is in the description. And feel free to reach out with any question about patient stories, finding a clinician, or your own personal experience. Also check out the description below for more helpful resources. If you find these videos valuable and would like to support what we do, don't forget to subscribe and hit the bell button to stay updated when we post new content. Thanks so much for watching and for being part of this community, and remember, your story matters.